Raj, Brand, and Tim, and I will have them actually, give them a hand. Thank you, whoever started clapping. All right, have a seat, guys. Welcome. So good to be with everyone in person. I know I'm not the only one here who has Zoom fatigue. So let's go down the line. Please introduce yourselves to everyone. Tell us about your company and the moonshot that you're addressing. Sidney, let's kick it off with you.
So I'm the CEO and the co-founder of Oro Devices. We make a product called the NextStride. It's a non-invasive mobility aid for people with mobility disorders to help people walk safely, confidently, and independently. The health and moonshot, so there's kind of two that we go after, the aging in place area as well as chronic diseases, because we start in Parkinson's.
Okay, yeah, so Parkinson's is your initial target market.
That's right. And then we expand from there into stroke rehab, multiple sclerosis, cerebral palsy, and eventually getting out to the elderly population in general.
Love it. Raj.
Awesome, yeah. Raj Amin, I'm CEO and co-founder at Wise Therapeutics. We're in the therapeutic gaming space, so this is part of the digital therapeutics industry that's been emerging and really accelerated through COVID. So we use casual gaming as a modality to treat patients for a variety of different mental health conditions. Specifically, currently we have a released product around stress and anxiety, but we've got a pipeline of products for a variety of different conditions: stress and anxiety, depression, alcohol use disorder. And so really what we're trying to do is lower the barriers to engagement for early mental health treatment using gaming as a modality. And there's been 83 billion downloads of games, so it's something that's already being used, and our goal is really to leverage that approach to get to people earlier and escalate care as needed.
Awesome.
Yeah.
I can attest. I've tried your game. If you guys check out Personal Zen, I'm sure nobody felt any stress in the last 2 years.
That's right. It's the first company where my kids can beta test the product for me.
Yeah, I showed it to my kids too. They were like, "Can I play that game?" All right, Brant, over to you.
Brand Newland, the CEO and co-founder of Goldfinch Health, surgery and recovery navigation. We bring nurse navigation and enhanced recovery after surgery protocols to the surgery experience across a wide variety of surgeries with the goal of helping folks get back to their life sooner, minimize expense, and minimize the toll on their life, and economically and humanistically. A key part of what we do in our moonshot is related to addiction. So much of opioid use begins around surgery, and this is the ticket to primary prevention. Prevent the overdose by preventing the first dose.
And I love the kind of surgical procedure pathway that you push people down. Maybe just share a little bit about the stats of the reduction in opioid use that you all are seeing, because I think it's really phenomenal.
Yeah, over 80% of the patients that we're serving in enhanced recovery after surgery protocol, supported by nurse navigation, don't use any opioids at all. We've been trained to think that opioids are the good stuff. That's what you want when you need pain, but that's not true at all. They're actually not even that good at pain management, and let alone they bring all of these side effects and addiction with them. So if you can get ahead of the pain, treat the pain differently, put the patient at the center of the experience, you have a much different outcome.
Yeah, and then maybe wrap in some Personal Zen.
We're talking about that already.
Mental
Absolutely.
preparation for surgery is just as important as the physical.
Makes a lot of
Avoidant
sense.
behavior, related to surgery. So yeah, absolutely.
Yeah.
It happened in the back room here. Another StartUpHealth
Magic's
deal
happening.
was born.
There you go. I'd love to see it. Tim.
Great. Hey, everybody. Good to meet you. I'm Tim Fitzpatrick, co-founder and CEO of Ikona Health, and we are a company that is an education technology company powering learning and kidney care, starting with home dialysis. So we have a pipeline of products. Our first product is a virtual reality education module that helps patients who are in-center on hemodialysis understand home treatment options, and we work with dialysis providers to help those patients understand and select treatment decisions based on what is best for them. In many cases, that is home dialysis. To your point here, I was a patient in the VA, a lot of surgeries, a lot of recovery time. I think both of these products I could have used, and I definitely need to download and try myself. So, and a lot of people to pass this along to. So good to meet everybody.
Yeah, and just quickly, Tim, while we're on you, tell us a little bit about the kidney care market. I don't think everybody is familiar of just how huge it is, and also the changes that are happening and how care is being delivered.
Absolutely. So this is a huge piece to understand that probably is going to delve into quite a bit of what people are focused on in the audience, certainly with us, and seeing across the kidney care spectrum. But high level, 1 in 7 US adults is estimated to have kidney disease today. So more than diabetes, and it's often called the silent killer because there are very few symptoms, if any, in the early stages. So 1 in 3 Americans, US adults today, is at risk of developing kidney disease. It's a staggering number. 1% of Medicare beneficiaries are on dialysis for end-stage kidney failure, but it's 7% of the costs. So combining the cost of CKD management and care with kidney failure, it's just an enormous area. So what Katya alluded to, 2 years ago, there's an executive order passed that really kind of changed what we've seen in the kidney care landscape, the Advancing American Kidney Health Initiative, which says that patients should be treated at home. Right now, about 10 to 12% of all patients on dialysis are at home. That number needs to get to closer to 80% by 2025. So in 2025, 80% of patients who have kidney failure shall either start dialysis at home or have access to a transplant. So that's having a lot of ramifications for population health management. The reason we're seeing capital inflows into effective care management earlier in the disease progression. How can we lower costs and then improve the transition from CKD to kidney failure if and when it does happen?
Wow, that's an amazing number in terms of the change that's happening there to go, with the goal of 80%, but it makes so much sense. So that's something I'd like to talk about. I love talking to you all because you're all doing such different things, and I feel like we're just getting little knowledge bites from different parts of the healthcare ecosystem. You've been on the front lines, all of you, during COVID, and a lot has changed in the areas that you're all working in. So would love to hear from you three who haven't shared. What are some of the trends that have come up in your space? Sidney, why don't we start with you?
Yeah, well, when you look at Parkinson's disease specifically, right, there are these articles that are coming out showing how COVID affects this population, showing that we're worsening BMI, there's increased falls, there's decreased mobility, and all of that shows the need for technology for people to use at home to be able to improve those activity levels, to be able to decrease falls, to be able to allow people to move around their house a little bit easier without having to go into the physical therapy clinic, which is why we created this device, right? Is these visual and auditory cues that we use, they're standard practice in any physical therapy clinic. But what was missing was a way to take that technology from the clinic to allow people to use at home, to be able to go to the bathroom by themselves, to be able to, for the guy that we made it for, Jack, to be able to go on a walk with his wife, Sandy. So it just underscores the importance of having that technology to allow people to stay active at home.
Mm-hmm. Another potential overlap here with the treatment at home.
Yeah, definitely.
Theme. Raj, how about you? I know there's just been an explosion in terms of the direction that you're headed with WISE.
Yeah, I think one thing the pandemic certainly did was put mental health in much greater focus. As a country, and in fact, this was echoed in President Biden's address. That really putting mental health at the top of the funnel. But I think what we've also learned is that you can't depend on employers to push products to their employees and say this is all we're going to offer. You've got to integrate it to the way that care is provided. So I think the big focus has been how do we get this in the hands of providers so that they can be the front line, bring digital tools to bear so that you're not using pharmacological prescriptions as a first line where it shouldn't be a first line. The whole industry of digital medicine has evolved very quickly over this last year where, we didn't have CPT codes for this a year ago. And now these CPT codes are in use. So we've got a lot of the barriers for using digital medicine in real care provider pathways. Those barriers have been lowered so that we can really integrate these types of tools into normal way we care for patients, which I think is super exciting. And we've certainly seen that the data says that compliance with these programs is massively higher, than just promoting a Headspace or Calm app by your employer. So we get 85% compliance when it's given to you by your provider, which is it's an amazing difference when it's integrated. And then you can also, of course, escalate care into the behavioral health pathway as you need to there. So I think that's been a huge change, and I don't think it would have happened if we didn't have the pandemic really pushed us forward to think differently.
That's incredible. As you're talking, I'm thinking back to some of the early in digital health, mental health startups, that were just trying to figure out the business model. And without those CPT codes, it was just very, very difficult, and they were very early. And
That's
so
right.
It's
Yeah.
a great time to be doing what you're doing.
Yeah, and I think the other thing is that the FDA now really has a clear pathway for getting their stamp and having real clinical data around these apps. So you're not kind of operating in a world where you've got to trust whatever you see on the App Store. So that's a big change too.
And curious, what has your direct-to-consumer experience been like? What have you learned from that process?
Yeah, so I mean, we don't actively promote our direct-to-consumer, although we got covered on the Rachel Ray show a couple times, and we, my marketing people were like, "What's the spike from? Where did that just come from?" And it's from Rachel Ray. So I think what we've learned from the direct-to-consumer approach is that consumers like games. It's easy to talk about, and I think that if you get the messaging right, they're willing to try it. And then so we have a real world example of how people engage with the game, what kind of wraparound features you need to be able to sustain engagement. So it's been helpful for us, but we know also that the real pathway needs to involve a provider, and that's where you get sustained compliance. And because people forget, the world is noisy, and so when you have a provider involved and you're going to see that provider again. You think more about compliance in that context, and it's given to you by someone who's authoritative. So, I think we get the consumer learnings, but really we've also learned that the provider is really important to that equation.
Well, I love the idea of digital therapeutics being prescribed as the first step.
Yeah,
That's really exciting.
I was going to underline that as well. I think that is so important to not have the first thing that you go to be the medication.
Yeah.
Are there non-invasive solutions that we can use?
And that ties into what you all are doing, Rand, to try and reduce how much opioids are prescribed. And what have you been seeing in your space?
I was going to say, I'm a pharmacist, and I still endorse the non-pharmacological option first. So I was going to hit on delayed care, COVID delayed care. That's a big trend. It certainly applies to what we're working in surgery. There was an estimate that said that in 2 years, there'd still be 1 million orthopedic procedures alone in the backlog.
Wow.
People who had a need for surgery and hadn't gone to surgery because of rightful concerns about exposure to the healthcare system. We can probably all think to ourselves about screenings that we haven't gone to. If you're a typical patient, you stayed out of the healthcare system. Unfortunately, what that means is that whether you delayed a surgery you already knew you needed or you delayed a screening that you didn't even realize you needed might mean that you're in line for a more advanced disease state and a more advanced care option when you do show up for that care. It might also mean that you've been delaying care because you didn't want to go in for your knee replacement. You've been delaying it with steroid injections along with an opioid prescription, right? Mm-hmm. All of that contributes to a patient who's in a much more concerning state when they show up for surgery. And all the more reason that they need a little bit of extra support. They need to take advantage of the science, the enhanced recovery after surgery protocols that superpower the patient for the stress of surgery, both mentally and physically, to get through it as best they can.
Yeah, I've been shocked to hear what some of the surgeries that are classified as elective during COVID. I mean, cancer surgeries and other seemingly, to me, doesn't seem elective at all, but there's so many significant outcomes that are impacted by that.
Yeah.
So amazingly, we only have 3 minutes left, but I would love to hear from one or two of you. It's been such a turbulent couple of years, and for a lot of businesses, also great couple of years in digital health. We've seen an amazing uptick with revenues and sales cycle shortening and all that. But as entrepreneurs, what have you really learned? What's been the biggest lesson that you've learned and that has been helpful to you as innovators during this time? Who wants to volunteer for that? Tim, I could tell.
I'll jump in. I mean, it was, of course, a very difficult challenge, less difficult for us and the people we serve, of course. But the number one thing it forced us to think about is immediately people's responses to us when COVID hit was, "You're a virtual reality company. This must be amazing for you." Not really, because you're sharing that device inherently in a dialysis center among patients. Mm-hmm. That's not happening, right? Or the staff who facilitate that interaction who we've trained and spent years conducting validating tests and these tools with, it helped us realize who we were as a company and what our actual value was, and that is as a learning science company that has certain products that are extensions or results of that meticulous process, this 3-step approach we have, of which VR in-home dialysis is one. So for 2 additional years, we figured out how to scale that, and we have great results, transitioning patients 3 to 4 times faster than our partners were able to without us, 37% increase staff confidence at the front line of care talking about home, 40% reductions in patient anxiety thinking about home, which is a top barrier to going home. So we now know that VR is not everything for Ikona, but we have a process that allows us to build our pipeline of tools that will extend that into the home and address the new series of problems that will come from this transition I mentioned.
Good for you. It's been a lot of iteration during COVID. Raj, you're a serial entrepreneur, so I'd love to hear what are some of the lessons you would give to first-time entrepreneurs too.
Yeah, I mean, I guess I'll give something more general, which is that I think the whole kind of concept of team building in a startup, has changed, right? And so recognizing that everyone needs balance and being a little more proactive to check on your employees and stress levels and things that might be happening in their world, because we've all had our entire worlds upended over the last couple of years, and I think it's been more important to just kind of check in and make sure that everyone's okay. And so, we used to have a lot more in-person interaction where these informal interactions would happen in a startup where, you do the after work drinking and you do the hallway conversations and you can kind of get that information that way. So I think it's just changed the way that we've had to operate as startups to really build these teams that are distributed and also kind of find ways to check in. So I just think as a CEO, it's more important. You have to kind of be a little more proactive now to make sure that you're doing those check-ins. So that's more of a generic response to the startup ecosystem, but certainly I found that difference to be important.
Yeah, we find that within our own team at StartUpHealth, and this event is such a great opportunity to be with you all. And I also met 5 team members yesterday of our team that I had never met in person. So that has been long overdue and just really refreshing. Well, thank you all for being here. It's a pleasure to chat with you. And you guys can find these good people down at the pavilion. And give a hand to our panel.
Thank you, Katya.
Thank you so much for having us.
Yeah.